एवरीवन, वेलकम बैक टू माय चैनल माइंड द गैप। आई एम जयति और आज की वीडियो में हम डिस्कस करेंगे थोड़े से और मिथ्स के बारे में जो हमने लास्ट वीडियो में एक कॉन्वर्सेशन स्टार्ट करी थी ऑन द ओकेजन ऑफ मेंटल हेल्थ अवेयरनेस मंथ। हमने बात करी थी अबाउट सम मिथ्स लाइक यू हैव टू बी इन थेरेपी फॉरएवर और थेरेपी इज ओनली फॉर मैड पीपल, पागल लोगों के लिए होता है, or you don't have friends. If you're going to therapy means that you don't have friends, and many other myths that we spoke about, and some clarifications on what mental health is really about, what therapy is really about. So if you've not seen that video, please go check it out, and let's get started on today's video. So the first myth for today is therapy is not applicable to all problems. It is not for everybody. It's young people's fad, and it's not for people from all walks of life, from people of all ages. Therapy can be for anybody. There are child psychologists, adolescent psychologists, there are adult psychologists, there are queer affirmative therapists, therapists who work with the queer community or support the queer movement. There are trauma therapists, there are geriatric therapists, so people who specialize in working with with older population, and these are not mutually exclusive categories. There can be therapists who work with couples and families, but also with individuals who specialize in working with children, but also take family therapy. So the best thing is to when you reach out to a therapist, talk to them about what they specialize in, what they worked on, and what are the kind of people that they specialize seeing. So if you find the right therapist, if you find the person who you relate with, therapy can be for everybody. बहुत सारे लोग होते हैं जो प्रेफर करते हैं कि उनको कोई थेरेपिस्ट मिले जो अपनी नेटिव टंग में बात करता हो, and that's absolutely fair because a lot of times you are able to communicate better in your native language, in your mother tongue, so that is also possible. But if you were to ask me, I think the best thing is to be very vocal and communicative with your therapist. Discuss the issues that you're facing with them. If you feel that you are not the right fit for them, or they are not the right fit for you for whatever reason, it's always best to reach out to them, to talk to them about it. And an ethical therapist would be somebody who would actually listen to you, would take your concerns into consideration and talk to you about them. So either work through it, या actually में अगर लग रहा है कि आप दोनों साथ में काम नहीं कर सकते हो, there's always a way to find another therapist. Therapy is a lot about understanding more about yourself, feeling more connected to yourself, to your emotions, your thoughts, feelings. And the more we do that, the more our quality of life improves, and we transform not just in therapy but also outside of therapy in our लाइफ ओवरऑल. और थेरेपी बस एक स्पेस प्रोवाइड करती है जहाँ पे हम एक मिनट रुक के उन प्रॉब्लम्स को देख पाएँ, उनको समझ पाएँ, उनको फील कर पाएँ, सो दैट वी आर एबल टू डील विद दीज इश्यूज, विद दीज कंसर्न्स डिफरेंटली in the future. The next myth, which is very interesting for me, is therapists are mad themselves. Therapists या psychologists तो खुद ही पागल होते हैं. Not sure which therapists these are. First of all, मेरे आसपास तो ऐसा कोई भी नहीं है जिन्होंने साइकोलॉजी पढ़ी और वो पागल हो गए, या वो ऑलरेडी पागल थे और थेरेपी जाने के बाद या साइकोलॉजी पढ़ने के बाद और पागल हो गए. But yes, because therapists do engage with emotions, work with emotions, human interaction so closely, probably therapists, we as therapists are more are more sensitive, or because we engage with human interactions and emotions so much, probably would be more active in that area, probably would feel more, probably would be sensitive more, would be observant more. And yes, ये बात बिल्कुल सही है that because of the occupation, we as therapists, we engage with such emotionally loaded material in our therapy sessions that a lot of times if we are not constantly working on ourselves, जैसे मैंने last video में बात करी थी, if you're not being ethical in the work that you're doing, if you're not going for your own therapy regularly, or if you're not going for supervision, or if you don't have the right kind of peer support, या आप पूरा दिन बस सेशंस ले रहे हो और लोगों से बातें कर रहे हो उनकी प्रॉब्लम्स के बारे में, of course it will take a toll on anybody, not just a therapist, right? So if you're working on yourself constantly as part of your profession, then this myth does not hold true at all. In fact, in my own experience studying psychology, being a mental health professional, having a peer support, having a life outside of this, therapeutic circle or the patients that you see, and also studying about emotions, reading about human interactions, it actually enriches my life more. एक इसका opposite myth है, which is that therapists are sorted. Therapists की life में कोई problem नहीं होती. क्या उनकी लाइफ एकदम सॉर्टेड होनी चाहिए बिकॉज दे आर स्टडिंग साइकोलॉजी, बिकॉज दे आर मेंटल हेल्थ प्रोफेशनल्स. Therapists are also humans. They are also prone to concerns in their private life. They are also somebody who might go through a difficult time emotionally, mentally. Yes, perhaps because of being part of this profession, you arrive at some insights quickly because you have the resources for it. At least उसकी accessibility ज़्यादा होती है, but does not mean that a therapist has an answer to all the problems in their lives. Therapists can also have difficult relationships. They can also have bad days. They can also go through something that they are not able to make sense of. You cannot analyze yourself all the time, right? So just like people come to therapy, therapists also need therapists sometimes. Therapy is not about having a perfect life, or being a therapist does not mean that you have to have a perfect life. Going to therapy, studying psychology, or becoming a therapist does not make you immune to the negatives in your life or to the difficulties in your life. It just tells you that it's okay to feel emotions and all emotions are valid. And there are ways to look at it, there are ways to deal with it, deal with the negativity, deal with the negative emotions, with the problems in our lives if you feel ready, if you're open to looking at it. The next myth is therapy is about blaming your parents for everything. See, there's no denying it. Much of the work in therapy is around relationships, and relationships include your family, your friends, your siblings, your extended family, parents. So for example, somebody comes to therapy and I see that they find it very hard to express themselves in relationships, and because of that, a lot of times they feel that they are that they're not heard, or they don't feel like they're understood. So therefore, sometimes we go back to our relationships with, say, our family members, our parents, our siblings, to see कि कैसे patterns वहाँ पे थे, which you might be carrying without realizing, to other relationships. तो यहाँ पे इसका ये मतलब नहीं है कि हम पेरेंट्स को ब्लेम कर रहे हैं या फैमिली को ब्लेम कर रहे हैं या सिबलिंग रिलेशनशिप अटैक हो रहा है, बट इट्स फॉर अंडरस्टैंडिंग द पैटर्न्स दैट वी कैरी, the relationship patterns that we carry, so that we are able to understand it, so that we are able to change it if need be. पर हमारे कल्चर में अपने फैमिली के बारे में बात करना या अपने पेरेंट्स के बारे में बात करने को इतना स्टिग्मेटाइज्ड किया हुआ है कि if you're talking about our family, firstly there's such a big guilt attached to it that हम अपने घर की बात बाहर कर रहे हैं. इसके बारे में मैंने स्टिग्मास के बारे में मैंने पहले भी एक वीडियो में बात करी हुई है, that we feel so much shame talking about our family, particularly our parents, thinking that they've done so much for us and हम क्या कर रहे हैं, हम उनकी बुराई कर रहे हैं थेरेपी में बैठ के. So it doesn't feel right. It evokes a lot of shame, it evokes a lot of guilt for us. But because it evokes so much, because there's so much stigma attached to it, हम जो patterns हैं वो भी हम देख नहीं पाते हैं, उनके बारे में बात नहीं कर पाते हैं, and वो patterns सालों साल चलते आ रहे हैं, चलते आते हैं हमारे generations and generations of people making the same mistakes sometimes. वही हम patterns दोहराते चले जाते हैं without realizing that it might be doing more harm than good. The next myth is therapy is all about the past. It's all about discussing your childhood traumas. It makes you get stuck in your childhood. ये थेरेपिस्ट तो हमेशा चाइल्डहुड के बारे में बात करते हैं. The work of therapy is to look at the past, keeping the present and future in mind. हमारे करंट पैटर्न्स या हमारे करंट रिलेशनशिप्स कई बार हमारे पास्ट एक्सपीरियंसेस या पास्ट रिलेशनशिप्स से इन्फ्लुएंस्ड होते हैं. सो इफ यू आर डिस्कसिंग अबाउट द पास्ट, it's about looking at the past patterns or relationships that we are carrying into our current relationships and how we can change them. But having said that, for sure, some people do have difficult childhood, some people do have some traumas in their childhood, and when they come to therapy, they start unearthing it, they start talking about it, and we realize that there's so much that we carry from our childhood, because of which we are not able to move ahead in our relationships, in our lives. The last myth is therapy is advice giving. In actuality, in reality, therapy is very, very different from advice giving. A therapist is a professional facilitator. What that means is that, it's almost like therapist और हम therapist और patient साथ में एक journey ले रहे हैं into the patient's life. And a therapist, what they do is that, they make some observations, they make some insights. हम सिर्फ एक रास्ते दिखाते हैं, the journey that we take together, and it is on the patient, what they want to pick up on, what they want to discuss further. So therapy, as hard as it can be, जितना वो emotional investment require करती है therapy, it is also very empowering. It can be very empowering. And advice giving and advice taking is not necessarily empowering. It does not push the person to make their own decisions. And as a therapist, it is my responsibility to make the person in front of me feel that they can make their own decisions, to instill that confidence in the patient. They are actually coming to me discussing their life problems with me, and they are discovering what they want to do. It's not about telling the person what to do, it's about discovering it. The goal of therapy is to actually help the patient, help the person in front of me to gain their voice back, and they are able to internalize it. तो मतलब जो वो एक सेफ स्पेस जो वो एक थेरेपी में आके जो भी डिस्कस कर पा रहे हैं, कल को वो जब थेरेपी से बाहर चले जाएं तो वो सेम डिस्कशंस अपने साथ कर पाएं. दैट सेम trust that they built in themselves in therapy, they can carry it outside of therapy as well and make use of it. तो थेरेपी हमें पुश करती है अपने बारे में सोचने के लिए, बिकॉज कई बार क्या होता है कि हमें सॉल्यूशंस पता होते हैं. Say for example, if you're in a difficult relationship, you have to get out of it, पर हम निकल नहीं पा रहे. So a therapist telling you कि इस relationship से बाहर निकलना है would not necessarily help. If you were not able to do it by yourself even when you know it, how would a therapist, practically a stranger at least, in the beginning, when you start therapy, how is that going to help? So that's not long-term healing. The work of the therapist is to make the person aware of some patterns, some insights that would be helpful for the person to make sense of themselves better. That's all I have for you today. I hope you liked the video. Please let me know what you thought of the video below. Please like, share, subscribe. If you don't want to write in the comment section below, you can also write to me on email. The email is in the description below. I'll see you next week. Till then, take care and bye-bye.